Let's take a look at some of the common terms you may hear or come across when working with your Muslim patients. First, the term Allah. What does Allah mean? Well, quite simply, it's the Arabic term that refers to God. And not only do Muslims use this in the Arabic language, but also it's commonly used by Christians, Jews, and people of other faiths. Next up, we have the term halal. You'll often hear this when referring to food, and quite simply, it translates to permissible. But sometimes we'll also be referring to whether or not the meat included in a dish is slaughtered in the Islamically appropriate way. The opposite of the term halal is haram, and that refers to things which are forbidden. And in the context of food, that would mainly be pork, anything containing pork, and anything containing alcohol. Next up, the term hijab. You may have noticed that sometimes Muslim women choose to cover their hair and wear very modest clothing. This is often referred to as hijab. However, keep in mind that not all Muslim women dress in the same way because, as we already have mentioned, there is a lot of diversity within the Islamic faith, and oftentimes dress is influenced by culture. The last two terms I want to cover with you are imam and Quran. What is an imam? Well, quite simply, a spiritual leader in the Muslim community, not much different than a rabbi or a pastor. An imam can be called upon for spiritual advice and also to come and offer prayers and comfort for families and people who are in a healthcare setting. Lastly, we have Quran. What is it? It's the scripture of the Islamic faith, in many ways similar to the Bible and other holy scriptures. It contains within it guidance from God for humanity, instructions for Muslims on how they can live their life in the best way possible, and also stories of prophets who came before. And there you have an overview of some of the important terms in the Healthcare Guide to Islamic Religious Practices. Be sure to look over the other terms and of course reach out to us if you have any questions.